Hello, this is a recording of the lower GI system. So because there's again a great variety of lower GI tract problems that occur, we're going to discuss some of these problems and review some of the anatomy and physiology issues. So again, there's multiple ways of doing it. We have the PowerPoints already been posted for you. So the first problem, of course, that occurs and most common is diarrhea. And so we have to, if you look at table 45, 1, 2, and 3, you'll find the common elimination problems of diarrhea, which of course can be caused by C. diff and various issues like that. So there's infectious diarrhea, and basically we want to look at the concerns regarding the fluid electrolyte imbalances that are caused with diarrhea and how it can be treated. So we have fecal incontinence, and so we need to describe some of the causes of fecal incontinence and how it's diagnosed. We would like you to identify how you care for fecal incontinence, and again, that's available in your textbook on page 167. Also, we'd like you to discuss some of the advantages and disadvantages of some of the interventions, and so that can be available. Again, one of the most common complications of the lower GI is constipation. And of course, in our chronic conditions, constipation would be the most common. And what is the nursing interventions that we can get into with that? So we need to discuss what are the causes of constipation. For our senior population, of course, it is inadequate diet and inadequate fluid intake, inadequate fiber intake. We need to identify what are the causes of hospitalization for patients with constipation, and then also we need to, so there's a table 45.1 of the common causes of constipation that I'd like you to look at, and that might be a question for the exam. Then also I'd like you to look at what the over-the-counter laxatives and the different kinds of over-the-counter laxatives. Keep in mind that if some of our seniors take over-the-counter laxatives that are stimulants, it does cause a lazy bowel. And if you do have a lazy bowel, then you create that lazy bowel and you don't use things like Metamucil, which draws fluid into the bowel and it sort of increases the fiber. Which Metamucil will do is provide fiber as well as draw fluid into the bowel. Then if you're taking a stimulant such as Senna, then basically what you're doing is the bowel will sit and wait to be stimulated. It no longer stimulates itself, and that is really one of the things that will lead to constipation, which again leads to diverticulitis, and there's ongoing problems. So we really need to train our seniors to increase their fiber, increase their fluid, and I know it's difficult for patients to drink lots of fluid, but it is really, really core to them avoiding the constipation. So what are some of the key teaching points you need to think about? Irritable bowel syndrome is very, very common in our population as well. So the focus on the diet, we need to look that up. So that again, here's your it's where it is in your textbook and the key points. Ulcerative colitis is very, very common. Again, it's an autoimmune disease. We'd also like you to, it's a very common cause of an acute abdominal pain, which we're not really discussing in this semester, but basically it is also leads to chronic pain. There's also the nursing management of it, and so basically, but it does lead to chronic conditions. Crohn's disease, it definitely is a chronic kind of condition as well, also an autoimmune disease. Basically, it is it will lead to individuals needing to, if it's not well controlled, they will end up having a colostomy, so it absolutely needs to be controlled, and there are multiple pathological processes to it, and as well as the medications that are required. The other inflammatory conditions, we have malabsorption syndromes, and what are the nutritional deficiencies that individuals develop with that. We have celiac disease. There are some common foods that you need to be aware of that they need to avoid. Then we have lactose deficiency diseases. And what are some of the conditions such as the dumping syndrome? What is dumping syndrome? I would like you to look that up. When an individual has an intestinal obstruction, what are some of the mechanical as well as non-mechanical causes of obstruction? So have a look at figure 45.4. What are the causes of that? And what is the treatment of those mechanical and non-mechanical obstructions? And then, of course, polyps. What are the causes of polyps in the large bowel? Where do polyps occur? Some of them are familial. So a little scenario of a 24-year-old child of a family who has familial polyposis and refuses to have a colonoscopy. Have a look at this little figure 45.5. Explain how you might encourage a client to go ahead and follow up on that, because it is one of the leading causes of colorectal cancer. And so actually have a little look at that and colorectal cancer and how it is actually how the incidence of high calorie, high fat diets in the Western population leads to colorectal cancer. And what are the clinical manifestations of colorectal cancer? Sorry, I'm not saying that right. But basically, how is it staged? So that's the other thing, is that I'd also be interested in you doing, looking at the staging. So the staging is in your textbook on table 4531, the different stages, and I'm actually going to post that particular page on your PowerPoint as well. And then, of course, the nursing management of that particular disease. And then this is the other common disease, is diverticulitis. With diverticulitis, one of the most common causes of it, people don't know they have it and then until they have a flare-up. And basically it is caused by a low fiber diet and with not enough fluids. And basically when you develop it, you will actually have leakage through the diverticulum into the bowel, into the peritoneum. It will eventually cause some adhesions, will cause bowel obstructions, and basically it develops acute pain. They will, if it is not controlled by a high fiber diet with lots of fluids, making sure that they have get control over the diet, they will end up with a colostomy as well. And then, of course, we have frequent patients who have all sorts of hernias. There are 4 types of hernias. That is on page or figure 4515, which of course leads to an ischemic bowel. So what is an ischemic bowel is another key question that I would suggest that you know. How do we get an ischemic bowel from a hernia? And that's a question I would ask you to know the answer to. And then, of course, we have hemorrhoids, and everybody, I'm hoping, knows what a hemorrhoid is. Very common. And how can it be controlled? And then, of course, fissures and abscesses, pilonidal cysts are also common problems in the lower GI system. So I hope that helps you sort of focus your reading, and you don't have to read the whole chapter. I'd like you to concentrate on some of those key points and be aware of where to focus, what kind of sort of interventions, what kind of medications do you really know at the level of a practical nurse, okay? And we'll hope to talk later.